This is not the time for fear or panic. This is the time to be prepared, to gather credible information, but it is a time to act. We need to change many things we do in our day-to-day activities to address these social distancing strategies.
Dr. Brent Roussin outlined the newest cancellations and recommendations in this quickly evolving situation. He says everyone returning from international travel should self-isolate for 14 days. Those planning trips should postpone or cancel them. Hospital visitors will be restricted to 1 per patient, except child patients. Visitor restrictions are in place at long-term care homes. And Roussin says to avoid large gatherings like crowded bars.
There will be a time when we get back to these activities, but now is not that time.
Healthcare workers tested over 1,200 people at COVID screening sites like this one in the past 4 days. The province reminding people to only get tested if HealthLinks recommends it.
They are not walk-in clinics.
But HealthLinks also overwhelmed with calls. The average time on hold yesterday was 1 hour and 43 minutes, down from over 2 hours the day before.
We will continue to look at processes to improve that. We'll also be testing a new online self-assessment tool to supplement the HealthLinks line.
Meanwhile, some doctors will be offering virtual visits.
Patients will be contacted by their family physician's offices, and they will be provided the opportunity to indicate whether they would prefer to make use of a virtual consult versus an in-person consult. Now, once again, it may not be appropriate for everybody, but it may very well be appropriate in many circumstances.
As the situation evolves, so do the measures the province is taking to prevent the spread here. They say to practice social distancing, but also check on those who are isolated.
We're all in this together.
In Winnipeg, Stephanie Lasuk, City News.